Welcome to tonight's segment of 60 Minutes. Tonight we will be discussing leukemia and all of its forms and the millions of people it affects around the world. Leukemia is a disorder that specifically affects the white blood cells in the body. Once these white blood cells are mutated, they are unable to fight infection in the body. Stay tuned on this segment. We will be talking to doctors and patients who have first-hand experience of this disorder.
Leukemia is a cancer of the white blood cells, but sometimes starts in other blood types. It is often described as being fast-growing or slow-growing. Here is a white blood cell. While red blood cells carry oxygen through the body, white blood cells help fight off infections inside the body. Here we have two types of blood cells. On the left is normal blood with a normal amount of red and white cells. On the right is a demonstration of what blood looks like in a person with leukemia. As you can see, there is a larger amount of white blood cells as they divide uncontrollably and leave little space for normal cells. Leukemia branches off into four different types. Acute lymphocytic leukemia is most common in children. It is the type of cancer of blood and bone marrow. Acute myelogenous leukemia, also known as acute myeloid leukemia, affects a group of white blood cells called myeloid cells. It is the most common type of acute leukemia in adults. Chronic lymphocytic leukemia mainly affects adults. This type usually progresses much slower than the other types of leukemia. It affects a group of white blood cells called lymphocytes. Chronic myelogenous leukemia is an uncommon type of leukemia. This type takes place in myeloid cells and most type of white blood cells. Welcome back to 60 Minutes. Today I'm joined by Olivia Tiano, an oncologist who works daily with patients with leukemia. She is here today to talk about the different ways leukemia is being diagnosed and the technologies used. Hi, Olivia.
Hi, Emily. So, there are many different ways that doctors are able to diagnose patients nowadays, especially with technology. So there's biopsies, which determine where the leukemia is in the body. We do bone marrow exams. We check if stem cells are growing fine and there's not any leukemic cells. There's also x-rays and CT scans, which also help determine where the leukemia is in the body and how far it's grown. There's also physical exams that people go to all the time that checks what their blood count is, how their cells are functioning, how their organs are functioning. And there's also lab tests. So people come in and they take blood tests and all the usual stuff is run that you would do in a typical visit to see your doctor. But nowadays, with the technology we have, it's very easy to find where the leukemia is in the body and at early stages, which is very crucial in a patient's process.
Thanks, Olivia.
No problem, Emily.
The pros of chemotherapy is that it shrinks the tumor, manages cancer, and cures cancer. Cons of chemotherapy are hair loss, infection, constipation, mouth sores, fatigue, and skin cancer. We are back with Olivia Tiano, who's here to talk about the different ways to treat leukemia.
So leukemia treatment, it depends on the patient. So it's very unique to the certain type of patient. So it depends on the type of leukemia they have, their age, and their overall health. So the main types of treatments that we typically use on patients are chemotherapy, which is the use of drugs to kill the cells. Radiation, which is high energy waves to kill the cells, which is almost like chemotherapy. And then we have stem cell transplants, which is we take the diseased bone marrow out of the bone marrow in the body and we replace it with highly specialized stem cells, and eventually and hopefully this will grow new bone marrow that doesn't have any leukemic cells.
Although there is no way to prevent leukemia, there are things we can do to lower our risks of getting leukemia. Avoiding high amounts of radiation. Avoid all types of smoking and other tobacco uses. Avoid all contact to the chemical benzene and other chemicals. We have just received a report from oncologist Olivia Tiano from Toronto General Hospital. This report explains the symptoms from leukemia and how the body is affected. Here's the report. There are many different symptoms when it comes to checking for leukemia. A new lump or swollen gland in your neck, under your arm, or in your groin is one hint. Frequent nosebleeds, frequent bruising, or very heavy menstrual bleeding is another symptom. Frequent fevers, night sweats, bone pain, unexplained appetite loss or recent weight loss, and feeling tired without a reason are all symptoms to having leukemia. Every day, hundreds of new blood cells are produced in the bone marrow, the soft tissue inside most bones where the blood cells are made, which provides the body with a constant supply of fresh, healthy cells. In patients with leukemia, the cells do not mature normally because the cells are unable to fight off infection the way healthy white blood cells can. As the cells accumulate, the leukemic cells interfere with the production of other cells, causing bruising, bleeding, and infections. These leukemic cells don't function like normal white cells, but instead they grow faster and don't stop growing when they should. This report is brought to you by Toronto General and 60 Minutes. Thanks for watching, and stay tuned for next segment.